communication characteristics, and trying to stop things before they do occur. And a lot of people say, and why in the world would you quit that? Well, look at the atmosphere, and then you get married. Kind of changes things. Currently, I work at Grand Gulf Nuclear Station. I'm a security shift supervisor, response team leader. Our guys, we're regulated by the Nuclear Regulatory Commission. We carry about, on your gun belt, you have about 18 to 20 pounds of gear, to include a handgun. You've got tear gas, you've got a gas mask, you've got rifle ammunition, you've got pistol ammunition. The handgun is a backup. Our primary weapon is the AR-15. And like I say, plenty of ammunition. We have standards that we have to meet as far as training and also our physical condition. We have to go through, we shoot a lot. Fortunately, we get paid to shoot, and they provide the ammunition. So you can't turn that down. For those of us that are interested in it, there are some that is not their cup of tea. Now, we also, on our standards, we're running like 100 yards within 1 minute time span. That's with full combat gear, to include the vest, ballistic vest. That's an additional 18 to 20 pounds. And you've got to go up like 60 stairs. And then once you get there, you've got to be able to communicate. Now, your time stops once you reach the top of the stairs. But our reasoning is, if you can't talk, you can't fight. So that's our job. When the bullets start going, instead of running away from, we're the ones that run to. Now, that being said, how many people here have any martial arts training, self-defense training? Several, but few. How many people here have actually been in a fight? I'm talking about a real fight. I'm not talking about brother, sister. I'm not talking about high school. I'm talking about street fight, bar fight, sporting events. There are a number of issues that come up and people have disagreements. But you'll find out real quick, even if you do train for that, when it goes down, it's not the same. It is not the same. Also, let's look at the difference in size. What you call disparity of force. Think that's an equal match? In a real fight, there's no such thing as a fair fight. You have to deal with it as it occurs. And it will never be what you planned on. And once they get you down, it's not civil rules. There are none. Once they do get you down as to how bad they're going to injure you, that's up to them at the time, unless there's somebody there to stop it. Okay, let's look at your environment. To an extent, you're in a controlled environment. You know where you work, you know who you work with. That part of it is somewhat controlled. We're lucky in the area that we're in. A lot of the personnel that come into the nuclear power plant, they have to go through the screening process. They go through the metal detector, all hand-carried items are x-rayed, and they go through an explosive detector to make sure that they're not carrying anything in. Y'all don't have that luxury. All the people that come in to work with us have all had the background checks. They've done the psychological and everything to make sure that they're good. For the most part, the people that you work with, that part you've kind of got an understanding. But then you have the people that come to you. You're talking about the patients and the families. That's what we're going to call the special delivery. Unfortunately, those are the ones that get dumped in your lap, so to speak, or delivered to you, to be polite. But you have no control over that. And once they get there, then you're the one that has to deal with that. Sometimes it's not only the individual, it may be, like I say, the individual's family. And it may be, if it's gang related, you may have the ones that are coming up trying to finish the job that they started. Now let's look at these two guys. All right, one's supposedly on drugs, and one's just, psychologically, he's not all there. Not a whole lot of difference. Not a whole lot of difference. Very unpredictable. Now the guys on the drugs, drug addicts, either they're on the drugs or they're having symptoms from the withdrawal of the drugs. And sometimes it may be the mental person that needs the drug to be able to function, and they don't have the drug, or they're not taking the drugs, which happens much more frequently than you'd like to think about. All right, you've got to stay engaged. You've got to stay engaged. You've got to be in the moment. You've got to use all of your senses. You can't be distracted. You can't just take and not be paying attention. You can't have other thoughts going through your mind when you're dealing with a patient. When you got the thing going on at that time, you got to look at them, their body language, their composure, their communication. But it's not just them themselves, it's also the family, because you're dealing with that. On your communication, a lot of it is going to be nonverbal communication. You got like 60 to 80% of your communication is nonverbal. That's going to have to do with facial expression, body language, gestures, just how they move, how fast they move. And then you've got certain symbols that we all use and we're accustomed to. Some are universal. I don't know. Or I may be perplexed. The halt. We all know the yes, and we all know the no. Unfortunately, you have a few of them that are not exactly what you would call universal in all cultures. If you look at this, we recognize that as the okay sign and thumbs up. In other cultures, that okay sign that you see means you kiss my, they're talking about a cheek, but it's not on your face. Also, thumbs up, thus it means okay, good to go. There are other cultures where that means the same thing as shooting them the bird. So you got to be careful. It depends on the different communications. It's going to depend on what your culture, what you're used to, what's going on with you in that given area. Like I say, you look at the body language, how they're standing, the look, you look at their face, if they got a frown on their face. Another big sign is if they'll look at you and glance at you occasionally, and they've always got that frown on their face. You kind of watch for that also. But that was one of the big things that we watch for, is watching people, learning how to watch people, and their body language, how they move, to kind of foretell what might be coming up. Because our biggest job, being the bodyguard or executive protection, was to see the symbols and to prevent things from happening. You also understand that one of the biggest jobs that you have in that capacity is to prevent the principal, that being the person that you're protecting, from embarrassment. So you're always looking out for anything that would embarrass them. Because if you don't prevent that, and you could have, you're not going to be very long at the job. And then when you start talking about also in your nonverbal, we'll talk about subliminal messages. If you're familiar with, like, they talk about the film, about like every 20th frame of the film, you don't see it, or you don't consciously see it. It's there, but you don't see it. That's when you got the big, fat, juicy hamburger, or the fries, or you've got the popcorn. It makes you want to get up and go to the concession stand. If you study communication and nonverbal communication, you find out that you've got those little micro movements and everything that people make. They don't even consciously know that they're making it, but you are picking up on it, and you're also translating. It's something that our bodies have developed over eons. It's just a natural occurring thing. and you don't even realize it's happening. All right, means the talk to, not at. The biggest part of your communication is kind of connecting with the people that you're working with. So has anybody, do you know what I'm talking about in regard to talk to and not at? Have you ever felt like somebody was just talking at you, throwing the information at you, but not really connecting with you? It kind of makes you kind of feel like left out or second class or something. You need to connect with the people. You have a tool I've heard of in regard to AIDIT, where you acknowledge the person. It's part of respect. Everybody wants to be respected. Nobody wants to be disrespected, dissed. All right, you introduce yourself. You're connecting with them. You let them know who you are. You talk about your duration. How long are they going to be there? And then you're going to explain what is going to go, what procedure they're going to do or what they're for. And then you're going to thank them. You're not wanting to be their best bud. You're not being their best bud, but you're making that professional connection and communicating with them. Now, when you do communicate with them, you kind of have to watch how they respond, because you're going to try to avoid any provocation. And if you feel like it's going that direction, you're wanting to de-escalate that, diffuse the situation. Because does anybody here really want to be in a fight? No, I don't. I'm trained for it, but that's not something I look forward to doing. Was anybody here, when you were training for your profession, did you take any defensive classes at all? Did you even mention it? Was that part of your job description? Unfortunately, at some point in time, those of you that work in the emergency room are going to either be attacked or you're going to have to deal with a self-defense situation, either yourself or somebody that you work with. And it's best that you kind of look ahead of that and kind of learn or take steps to deal with that. Now, let's look at presence and demeanor. Not a very big fellow. Not a very big fellow. When I tell people I used to do executive protection, they look at me and say, not very big. It's not necessarily how big you are. It's kind of like being knowledgeable in your profession and taking care of the business. Looking for those little symbols and signs that, like I say, we're trying to prevent things from occurring. A lot of that, look at the guy's facial expression. Now, is that somebody you really want to just go out and just tackle? Not necessarily. It's an unknown. It's an unknown. But how he carries his body and everything, it's kind of a position of strength to an extent. And you, when you're dealing with different people, you want to have that position of strength, because how they perceive you and as to whether or not they think you're weak or pushover, or whether or not a position of strength and something that they don't want to go up against. Now, you're not going to be the meanest mother in the valley. When you're the meanest, that means that you have somewhat of a nasty disposition, and you may be sadistic. You like to hurt somebody. That's not where you want to be. You want to be somebody that is tough, but can be polite as long as they let you. All right, let's talk about weapons. I was taught you are the weapon. You as an individual, you are the weapon. Everything else is just tools. All right, let's look at what we got up there. Got a hammer. Is that a weapon or a tool? You got a screwdriver. Is that a weapon or a tool? If you take and do studies, you'll find out screwdrivers are the second most used item to stab people with. And Bernard Goetz, anybody remember that little occurrence in New York on the subway? He shot several individuals that were accosting him, and they were carrying screwdrivers. Now, he got off on self-defense, but he did go to jail because he had an unregistered handgun. So those are the one tools that we normally associate with as weapons. But like in my profession, that would be considered a tool. And unfortunately, you're going to have a number of people dealing with knives. And in your profession, there have been people that have been shot. There have been people that have been stabbed multiple times. And also attacked and beaten. Now you look at these everyday items. You need to look at what you have available. All right, now this is a metal clipboard. Even if you have just a regular clipboard, that can be an effective weapon if used properly. Look at that ink pen. You don't think you could stab or hit somebody in a critical point with an ink pen? You can kill somebody with an ink pen. Very easy to do if you know how, unfortunately. But you don't want to be the victim on the other end of that also. All right, your main thing that you're wanting to do is you're wanting to defend yourself and escape. You're not wanting to stand there and fight. That's not the purpose. That's not why you're there. You want to defend yourself when the situation does occur, and then you're wanting to get out of the situation. Get out of there. Once it does occur and you're going to do the defense, it's got to be dynamic. When I say dynamic, you're going to apply the force or the movement that you're going to take quickly. Why? Because if you take and you let them know what you're about to do, or you hesitate, or you telegraph what you're about to do, then they're going to, if they do have a grasp on you, they're going to tighten up. Or they're even going to empower themselves. They're going to try harder at what they're doing. So if you're going to make that move to defend, it needs to be quick, decisive, and powerful. Now, you see these guys are practicing. If you have never taken any type of martial arts or self-defense, it is time-consuming. It takes a lot of time. And as to your ability is going to depend on what you choose to study in and how you apply yourselves to that. There's a lot of good self-defense courses out there. Now, I don't have any financial interest in the SPEAR program, but it is an effective program. The military uses it. The SPEAR program works off of a flinch reflex. All of us have the flinch reflex. When something occurs, and if it's coming at you, you're going to throw your hands up to protect or to cover. And they're recommending that when you do throw your hands up to cover, you're using your peripheral vision and everything. But when you throw it up, when you put your hands up, have your hands open. Open because it's not necessarily an aggressive move toward them. And you're keeping your arm kind of out at a kind of like a 45 degree. Don't bring it back because you're able to use more force in that direction. If you bring it back, then they can kind of push it back on you. You want to be from a position of strength to be able to deflect and defend yourself. As you see the guys coming up there, he's deflecting the move. He's taking a swing toward the head. Very effective on the spear. And it's something that you can pick up on and utilize, and you may have somebody that practices that in their area. Mike Blair is the guy that came up with the system. Like I say, the military does use it to include special operations personnel. And then you have your strike points. You have your focus areas where you're going to hit them at. Now you got to look at the person's position where they're at. The main thing is you train. You need to train and you need to practice. Decide what you're going to do. When we train, we have to train with our weapons or our firearms. We go through tactical courses. We have to carry our gear, and we've got a tactical course we go through, and we've got a certain amount of time that we have to accomplish that goal. When we are training, every magazine that we have for a rifle, every magazine we have for a handgun, has got anywhere from 1 to 2 dummy rounds in there. That means that when you pull the trigger, it's not going to fire. Why do we do that? Because if you're in the real fight and that weapon malfunctions, you've got to clear it, you've got to keep it running. You don't have somebody there to do it for you. It's your responsibility. But you've got to clear that, keep it running, and you still have to make that qualification time. Part of the point on being with that is, if you're going to decide on something to do, you need to practice. You need to get with somebody. That can be brother, sister, mom, dad, husband, wife, but you take the movements and you learn those. And what you're developing is muscle memory. Anybody heard of muscle memory? Go through the movement enough to where you don't really have to think about it. It becomes automatic. The good part of that is when things do go down, you don't have to think about it. It just automatically, you take action. And it pares the time down. You can do it now. You don't have to stop and think about it. Get it done. Because what are you looking at? You're looking at preventing yourself from being injured. And sometimes it may not be just you. It may be either another patient, and it might be a coworker. But looking at those, there's some areas that we understand as targets. You know, the throat area. The side of the neck is very effective. What they call brachial stun. If you use like a hammer fist or hit them in the side of the neck, it may, after a period of time, they may stand up for a little while, and they'll weeble and they'll wobble and they will fall down. Another very effective, and I tell you from personal experience, not from a fight, but just from soccer. Intramural soccer in college. You got knee in the top of the thigh. You got that nerve that goes up through there.